Rebonjour à tous. Veuillez prendre place assez rapidement, s'il vous plaît. Comme ça, on va pouvoir commencer à l'heure.
Est-ce qu'il y a nog place hier vorne? Il y a encore la place ici devant si quelqu'un n'a pas la place. Avant, il y avait des personnes qui étaient par terre. So, fine. Good. So, we can start with the next presentation. It's a pleasure for me to present Anne Benjaminse. She's not really here, but we will see a video from Anne. She's assistant professor at the Faculty of Medical Science at the University of Groningen in Netherlands. She researched, her research is focused on ACL injury prevention. Before we saw a lot of injury, and now it's good to see a little bit about prevention, and this is done via optimal motor learning. Anne has more than 60 peer reviews, publications, and is internationally recognized leader in her field. So we can start the video. You can make your questions.
This presentation is going to be a little bit
you can make the questions because at the end of the video, Anne will be here on Zoom.
Obviously, I'm not there live with you guys, unfortunately, but there's a good reason for it because I have to take care of a 8-week-old baby girl at home. But luckily, we could do it this way. Thank you, Mario, for that, and thank you and your colleagues for putting together this amazing program. And I want to say hi to my colleagues from here. And after this, there is a chance to ask live questions and have a discussion. So now back to the topic, neurocognitive approaches in ACL rehabilitation. I want to cover 2 subtopics, which is implicit motor learning first. And I want to address strength training and quality of movement. And then variation. And there I want to talk a little bit about the task change of direction or agility. But first we have to talk a little bit about learning, because when we talk about rehabilitation, we are talking about learning because, for example, the patient has to learn to squat with the involved leg with more knee flexion. So there is a problem, an issue to solve. So when we're talking about learning, I always like the saying from Benjamin Franklin, tell me and I forget, teach me and I remember, and involve me and I learn. And the latter, involve me and I learn, is so true for rehabilitation, because when we involve our athletes, our patients, more in their own learning process, the learning process will improve. And implicit motor learning is one way to involve our athletes more in the learning process or in the rehab process. And I will give you some examples later on. So as a physio, you have the choice to more instruct your patient, so tell me and the patient will learn, or facilitate the patient in his or her rehabilitation process, and consider if we are telling our solutions to a problem. For example, the problem is not enough knee flexion, so our solution would be, bend your knees more, or are we going to help the patients to find their own solution? And I will vote for the latter and will give you some examples and tell you why later on. So we go from learning to motor learning, and ideally motor learning leads to permanent changes or relatively permanent changes in motor behavior. And that will be shown in retention, so over time, and also in transfer tests or situations. So the most sport-specific transfer is that athletes, patients are able to show what they have learned on the pitch. And a smaller transfer is, for example, an athlete is able to maintain balance on a firm floor and later on to maintain balance on a bocce ball, for example. So the question I ask often to students, physios, coaches is, how did you learn to ride a bike? Think about it. And because this is not live, I will not wait for your answers. But the answers I often get from the people I'm asking this to is, my dad was holding me, trial and error. I was using side wheels. The answer I'm never getting is, I had to think about bending my knees, extending my knees, bending my knees, extending my knees. So this natural way of learning somehow has disappeared a little bit in our clinic or in our coaching strategies, but we should really take benefit of that because it's really powerful. So obviously that explicit thinking about own body movements is not our natural way of learning a motor skill. So I want to quickly show you this video. And this is a little bit over-exaggerating, but we as physios really need to be careful that we're not instructing our patients too much, because it will overload the brain.
Press the breath, check the grip, knees in, left arm straight, shoulder the target, your eye on the ball, weight on the left foot, bottom out, and relax.
And again, this is not real life, but on the other side, we as physios are really, because we want to help our patients so badly, it's in the core of our being, helping people. We use our instructions and our feedback maybe too much, and it's hard for us to do a step back and let athletes figure it out a little bit, which is hard, but it's at the end it's better for our patients. And it's also what athletes are saying. Here, the famous golf player, you swing your best when you have the fewest things to think about. And I also know that Roger Federer once said, my best tennis serves are those tennis serves where I wasn't thinking about how I was moving. So it's the goal for the athletes, for the patients, to be in the flow, and they don't have to think about flexing the knee, for example. Okay, some examples. Implicit motor learning, and there's tons of ways to stimulate implicit motor learning, and I'm gonna target those two today: external attentional focus and analogy learning. So first, a little bit the different. There's external attentional focus, like I said, on the right side here, and then you have internal attentional focus on the left side. So the internal focus, which replicates explicit motor learning, is telling explicitly to athletes or instructing them what they need to do. Flex your elbow to 90 degrees, flex your hips, bend your knees, etc. in this case. On the other side, we have the more implicit way of motor learning, where we give the athletes a task also, but we don't give them the solution on how to solve it. They are going to figure it out by themselves. For example, an analogy when performing a free throw in basketball could be move your arm like the neck of the swan, and then the player has to figure out himself, okay, how does that look like, and then what do I need to do with my arm. Also copy the movement of another player who's doing it better than the patient. Works really well. And you basically just give the instruction, copy the movement that you're seeing, and then again the patient has the opportunity to self-solve this problem again. Okay, how I'm going to copy this body movement. And then there's an external focus instruction, which has been researched very often. Focus on the rim of the basket instead of explicit instructions like on the left side. And focus on the rim of the basket has shown to lead to greater accuracy of basketball free throws. So here the rim of the basket is the external focus. So instructing basically kind of belongs to the explicit learning and facilitating more to implicit learning, because you don't tell the solution, but you facilitate by giving implicit instructions or feedback. So now to ACL rehabilitation. The traditionally more explicit instructions have been used. For example, do not let your knee buckle inwards, bend your hips, bend your knees, etc. But there's opportunities for us to transform this basically more to implicit instructions. Because implicit learning, again, there's less explicit knowledge about the movement, but patients are still performing the movement, but with less cognitive load. So we stimulate a more automatic learning process by applying this way of learning, and it leads to enhanced retention with both physical and mental stress or pressure, and that's really a good thing when we think about going back to the game, for example. So how does that look like then when I'm practicing with a patient? Well, first the patient already feels what he or she is doing. Okay, I'm doing a trial. How does that feel? How did it look like maybe when athletes are able to have a look at themselves? And we really should not interrupt, and we should give the patient the chance to indeed feel what they have been doing. Give that some time, and don't be with the patient right after a trial, but give him some time to reflect, basically. So that's the intrinsic feedback. Then extrinsic feedback is the feedback from us to guide the learning process. So there, it's our goal basically to help the patient again and find their own opportunities and solutions. And here, be careful with telling too much to them, because when we go back to the intrinsic feedback, if the patient, for example, already had the idea, okay, next trial I'm gonna shift, my weight a little bit more to the left, and he or she already has in mind to do that, then if on top of that we as the physio come with another instruction, it may kind of give, how to say that, like an error in their head, or it may be too much, it may be an instructional constraint if we on top of that give our instructions, our feedback. If it's meant very well, and it's meant to help them, but sometimes it's better to leave them and have them try their own thing, basically what they wanted to do the next trial. So we shouldn't interrupt basically with their learning process. And implicit learning can help our patients to find their own solutions. So, it's our task to have them or give them information to solve a problem. And please have a read of this tweet, this post by Nerit Rotem. So it takes time to learn a new task. And again, like I said, don't interrupt too soon and too often. give the patient the chance to process intrinsic feedback and explore the own solution for the next trial. And if we give feedback, I would advise to use implicit motor learning. Okay, a couple of examples of implicit motor learning for strength training first. And this is very powerful because research has shown that if you use implicit motor learning, so an external focus of attention versus an internal focus of attention, patients can gain 10% more strength. So that's worth trying, I would say. So I'll take this problem as an example, AMI, atherogenic muscle inhibition. So we need to activate the quads, we need to activate the vastus medialis, and how can we do this? So an external focus of attention is not something that you can only do further in rehab, but this is something that you can do already in the beginning. This girl is a couple of days post-op and playing a game, and with activating her quads, she has to reach certain goals in the game to hit the green balloons. You can see she has fun, and what you can also see in the results is that improving maximal strength in the game group went better than the control group with traditional strength training, like extend or with the traditional instructions like extend your knees. So this is something that can be applied easily. It's fun, it's challenging. The girl isn't thinking about extending her knees while she is doing this, but it's still very valuable. Then there's here's another example of isometric quadriceps exercise, which can be done pretty soon after surgery, and I'll play the video.
Isometric quadriceps exercise with EMG biofeedback. Here, the patient performs an isometric quadriceps exercise. Now, and as you probably also see in your clinic, some patients also contract the hamstrings too much, which in turn results in a flexed knee. However, one of our goals is to achieve active knee extension. Therefore, using EMG as a biofeedback system may be very useful. How does this work? The two bars on the left on the tablet are respectively for the involved quadriceps and the hamstrings. The third and the fourth bar are the same muscles, but now for the uninvolved side. To help the patient activate the quadriceps without co-contraction of the hamstrings, I have set the bar to the desired activity level. How? For the quadriceps bar, this turns green if she has activated the muscle at or above the target level. For the hamstrings, if she activates those too much, the bar will turn red. So, the instructions for the patient would be: focus on making the first bar green while keeping the second bar green as well.
So that would only be your instruction. Keep the first and the second bar green, and the patient then has to solve this problem, so to say. Another example here with the leg press. The involved leg is the right leg, and we want the patient to extend his knee more. We put a piece of tape on the Technogym machine, and the instruction we give the patient is to bring the yellow button as close as possible to the tape. Then we go to quality of movement. Here, this girl is performing a Bosu on a mini squat on a Bosu ball, and to stimulate symmetric squatting, I put a dumbbell there. And I'm not saying anything about shifting weights. The only instruction I give her is try to keep the dumbbell in the middle. So again, she has to solve this problem by herself. We can make it more challenging, putting a cup of water, and you can see she has fun. And again, you can see we don't say anything about shifting weights to simulate symmetric knees or symmetric squatting and symmetric weight bearing. Another example to stimulate knee flexion and trunk flexion is that we can say bend your knees while performing the squat, or on the other side we can use an external focus instruction is touch the cones to stimulate knee flexion. Again, we give a task to the patient and he or she has to solve the task. Then with jumping, so a little bit more progression, focus on keeping the water in the cup again. And what we saw here is that with this boy, the landing was stiff before the external focus instruction, and when we gave the external focus instruction about keeping the water in the cup, the landing was softer, and we could also hear it from the landing, that there was less noise when on the right side. So that's an external focus instruction, but we can also use analogies to stimulate soft landing. For example, imagine you're landing in a puddle and try not to splash the water. Okay. There's another example with also jump landing, again the progression. Within this study, the patient or the athletes only, when they were asking for feedback, they were only receiving the score of their the performance of their task, and they knew the lower the score, the better. So that was the feedback that they got. So it was basically a game for them, and they were like experiencing, okay, if I do this, the score is higher, but hey, if I do this, I was able to lower my score, and this way they were improving their quality of movement. Lowering the score in the external focus group, and what you see is also in the video group where athletes were able to watch themselves. The athletes were able to improve their quality of movement while maintaining jump height performance. Okay, to finish up with the variation, I'll take this task, like a defending change of direction task, defending agility task, as an example, as a case study. This is Viviana Minima tearing her ACL on her left leg while defending and trying to intercept the ball. What you see in real life is that defending and trying to intercept the ball is happening in so many ways. So there's no one way to perfectly perform this change of direction task. So it's repetition without repetition. You're defending again, and again, but in different ways each time. So we need to really ask ourselves, is there a perfect form of movement, or can we allow some variation? I think we can allow some variation, because when you even look within a person, you never perform a task exact the same way, but also when you see between persons, performing a task in a perfect way can be different from one person to another person. So for example, here there's two best tennis players in the world with the best tennis serve, but they perform their tennis serve completely differently. So realizing this has implications for the treatment of our patients. And we need to ask ourselves, okay, when we're talking about motor skill, what is actually motor skill competence. And it's not performing a perfect movement. No, it's the opportunity to efficiently and accurately find a movement solution for every situation that arises. So if that's our goal, that also has implications. So do we want to practice the ideal movement technique, excuse me, or do we want to facilitate the patient to find adaptable movement solutions? And I think we should do the latter. Because when we train perfect movement solutions in like clean situations, we are not optimally preparing our athletes for the return to sports situation. So what we could do instead is set up different situations to practice cutting movements or practice agility movements, still in a safe manner, but when the environment is involved. So there's a ball, there's an opponent, there's a teammate, etc. So performing cutting tasks in more meaningful ways. And of course, this is already advanced in a more, like I said, more return to performance, return to the field. But there's also opportunities to perform this in the clinic with a ball, making it a little bit more fun, but don't practice the only perfect movement form of cutting is my message. Practice with 2 people in a relatively small environment, and here they have to take care of, they have to watch the environment because there's another person in the room, so to say, but they also have to look at the screen because that assigns a task that they have to do. So, and now the combination of the two to finish up with is here when we have the athletes perform cutting movements here in the parkour, so to say, or in a tag game, we can also improve their quality of movement. For example, if we want to reduce their knee abduction while cutting, we can say if they have a logo on the midst of their shirt at the height of the chest, we can tell them point the logo of your shirt to the new running direction, or pretend your knee is a headlight, pointing the light to the new running direction, because this will, some research has shown, this will turn their body, those 2 instructions, in such a way that the entire body has like an athletic position towards the new running direction. And of course there's a typo there, sorry for that. Or to improve knee flexion, when you make the turn, push yourself off of the ground as forcefully as possible or try to accelerate as a rocket. And here the ground is an external focus of attention because the ground is what they focus on, and try to accelerate as a rocket is an analogy. Another example to improve knee flexion while performing a defending cutting movement, defending action, is pretend you're going to sit on a chair. Okay, and with this I want to finish up. I hope that I've been able to give you some practical examples of both implicit motor learning and variation and how you can mix those two. And I hope I've also made clear how this is involving the brain and cognition and mixing those two. Thank you very much. And I give the floor back to you, Mario.
Thank you very much for your presentation. I don't know what you are seeing, but some people are here in the room and they followed very interested your presentation. Are there some questions in the room?
So I have one from Slido. You can hear us? Yes? Yes.
Yeah.
Okay, good. There's a question from the crowd. Would you also train injury specific knee angles instead of preventing them to get the athletes used to sports movement as sports always as external focus? Like, yeah, training difficult situation, I guess.
I'm sorry. What do you mean with training different knee angles?
Maybe well, from what I understand is that maybe do you train in specific position where the knee could be in danger with external focus, or like how do you train in this position, delicate this situation?
Okay. Well, I'm not specifically searching for the dangerous positions, of course. But I think we should be careful with, well, like I said, only practicing like a perfect movement, because that's not what's happening on the field. So I think it's basically more allowing some variation within the safe range of motion, so to say.
So if the valgus is too important, you would correct it a little bit, or like
of course, if the knee valgus is too much, we can of course correct it. But when looking at videos of healthy football players, when we talk about football, we also need some valgus, like anatomically and functionally. So it's again, it's and that may be individually, maybe person specific. There's some room for variation, and there is some room for moving outside of the frontal plane a little bit, also depending on the amount of knee flexion, of course.
Do we have some more questions? I have one.
Yeah.
I love your analogy with the cycling, from a kid cycling. Like, how do we learn to do that? Do you think, so one thing we have to remember, I guess, is that we learn like this still as adults. Also, we can learn like this, but maybe slowly, or what do you think? Is that more difficult to do with adults? Learning?
Well, I think, like I said, that we should benefit it. Even as an adult, it's still our natural way of learning, because luckily during our daily tasks or learning new sports skills, for example, I mean, like since 10 years ago, I started mountain biking. Luckily, we don't have to think explicitly about our movements, because those brain resources, we need those for paying attention to the environment and look around us and see what's happening and anticipate and react to that. So yeah, still as an adult, that's our natural way of learning. And of course, people may have slight preferences, maybe, or they are used to being coached in that explicit way. But again, if we want to have optimal results in the long term, the more implicit way of motor learning is really the preferable way of learning. So yeah, even as adults, I think we should we can still use that.
Thank you very much. Yeah. So we have more questions coming in. So can you say for sure that internal focus is less efficient than external focus of attention? What does the research is certain about that? Is it better or not, or is it simply different?
Yes, research is actually pretty clear about it. We also wrote a systematic review compiling research and looking at jump landing tasks where they compared internal focus versus external focus. And well, so to say, 10 out of 10 papers showed the external focus being beneficial. So yes, research is pretty clear about it. What we haven't looked at in depth yet is the transfer to the field, for example. So that's a research area that we're going to right now, because most of the studies are done in a clean clinical or research setting. But yes, also in the ACL injury prevention or rehab area, but also with other tasks, the external focus, attention, implicit motor learning, most of the times have been shown to be beneficial. And I know it may be hard to come up with external focus instructions or feedback. So it may require a little bit creativity as a physio to come up with different instructions, but it's worth trying. And you know, don't go from like 0 to 100% in your rehab setting. Just try it once in a while. See if your patient reacts to it the way you want. If not, try a different instruction. Play around with it, and it's, you know, of course, it's not forbidden to use internal focus instructions, but it's definitely beneficial for short-term results. Internal focus instructions are more beneficial, but like I said, we want to have changes in the motor behavior in the longer term, and then external focus instructions are the way to go.
Thank you very much, Anne. And we wish you the best for you and for your family.
Thank you.
And thank you also for the questions. We can go to the next person.
Yeah, great question. Enjoy the day there. Bye-bye.